Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Hi, good afternoon.
Good afternoon. My name is Dilshad Burman. I will be moderating this chat today. I'm a writer and reporter with City and 680 News. The way this works is we have been collecting your questions all week, and we're going to present them to the doctor today. She's never seen them before. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we're going to try and ask the doctor as many questions as we can in this short 30-minute window that we have. We're going to get started with our submitted questions, and a maximum number of them are about vaccines once again this week. So let's start with vaccine questions. Doctor, you ready?
Yeah, let's go.
All right, let's start with Captain Bruce. Captain Bruce asks, will the person giving the shot sign my international orange vaccination card? Does public health still stamp these cards?
So when you go to a vaccine clinic in Ontario, they actually use this system called COVAX. It's an electronic system. It's a registration system actually to record that you received the vaccine. And as part of that system, at the end of it, you will get a printout with a recording of your vaccination. So you can actually keep that inside your vaccination card. You can glue it in, staple it, or however you want, and that will be your record.
Okay. And then LP, this is from Twitter, so it's LP Keep Kids Safe asks, postal codes all around me and across the street from me are allowed to get vaccines now. When will Toronto be open to all 50 plus and below? We don't live in a bubble in our postal code, and we're exposed in Toronto every day.
Okay, yeah, so good question. So the postal codes were defined by the province. So they were based on data that the province had about COVID and essential workers, and there were a number of factors that went into it. And so that's how the postal codes were determined. So just to let you know that there was a process for it, and fully recognize that, yeah, in Toronto, while 50 or so postal codes were identified, many others were not. So the goal is to get those in those postal codes vaccinated because they are higher risk. That has been identified. But eventually, yes, everyone will be eligible for a vaccine. Right now, they're doing a Toronto and Peel's hotspot postal codes. They will then go to the other postal codes hotspots in other parts of the province. Right now, I don't have any information from the province to say that, well, all of the other postal codes in Toronto will be vaccinated. You'll have to wait to see what your specific eligibility might be, but hopeful that by June or the latest July, everyone will have access to the vaccine.
Okay. And then Will asks, can someone who's been fully vaccinated still be a carrier of the original COVID strand or a variant and then pass it on to somebody else?
So it's not very common. If you had COVID, you're considered contagious, in which case you could pass the virus on to others for those 10 days. If you had a weakened immune system, you might be able to pass it on for longer. But beyond that, it's not likely. I haven't heard of any reports where someone had it and then 3 months later, the same virus were contagious for it. That's not something that I've heard of.
Okay, and actually we have a live question coming in from Bruce, and this is a question we've actually seen a lot coming up just in our interactions with people online. Bruce asks, where do I find out more information about the mobile and pop-up clinics that are vaccinating people 18 and over? The province directed me to ask the city directed me to ask the province. Are these mobile units posted somewhere? How will I know when one is nearby?
Okay, so the most important thing to know is that if you're 50 plus living in one of these hotspot zones, you can book already at a Toronto Public Health Clinic if you live in Toronto or by calling the provincial booking system. If you're less than 50 but living in one of these hotspots, it's going to be based on the mobile clinics. The mobile clinics are actually going to be done based on where the needs are in that postal code. As someone had said, well, other postal codes are not identified. And even within a postal code, not everyone within that postal code is considered to be at the same risk. And so based on working with community groups, with the hospitals, the Ontario health teams, they're deciding which mobile clinics to have and to have available to these hotspot neighborhoods. And so it's those specific clinics will be reaching out to who the population that they are trying to reach directly. And so that's how you might know if you're in one of these specific groups in one of the neighborhoods and in that age group, that's right now how the communication is going to go.
Okay, so recently we had in three downtown hotspots, really, the UHN was signing up people for pre-registration, 18 to 49. And then, of course, we saw today that they've said that they don't even have enough vaccines for all of the people that pre-registered. So is this going to be a pre-registration process for the mobile clinics as well, or are they actually going to reach out to everybody in those neighborhoods that are eligible?
So it will be up to the hospital. It's the hospital Ontario Health teams that will be doing most of the mobile clinics. So Toronto Public Health will be doing some as well. So it will be dependent clinic to clinic based on the area that they're serving.
Okay, makes sense. And then John asks, my parents have been in Canada for 6 months and will be leaving back overseas in a month. They want to get vaccinated now, but are worried about potential problems with getting the first dose in Canada and then getting the second dose of another brand in their home country. Is it okay to mix doses from different brands?
So right now, there is no recommendation for starting with one series and finishing with another. It is recommended whatever dose you start with, you complete the series with that. Now, recognizing there may be logistical challenges for that based on someone's personal circumstances, then the next principle is we'll try and get the same type of vaccine. So if it's a messenger RNA vaccine, a messenger RNA vaccine, if it's a viral vector, that kind of thing. So that's the guidance that's available right now.
Okay, and then sorry, so Bruce just has a follow-up question to his pop-up clinic question here. He says to follow up, the hospitals and groups will reach out to our condo, for instance, like specific buildings.
So I think it's important to note that while a neighborhood is identified as a hot spot, that postal code, it may not be that every single person living in that hot spot will be eligible for every single clinic. And so I think what you have to expect is they're going to go to the higher needs, so to speak, areas within the hot spot first. As more vaccine becomes available, you can imagine that there will be more and more eligibility. So if we have more vaccine, it could be that if you're 40 plus and living in one of these postal codes, you can register at one of our clinics. That's not available right now. But again, you'll have to keep track into the future to see how the eligibility is being rolled out.
Right. Okay. So first they'll go to the hottest of parts of the hotspot, and then it'll go further from there.
That's right. That's my understanding right now.
Okay. Okay, we've got a live question coming in from Richie here. Let's take this one. What's the point of getting the vaccine if you can still transmit COVID after you get the vaccine?
So we're actually getting more and more information that the vaccine is going to actually prevent transmission as well as infection. So that's good. So by getting vaccinated, you will protect yourself and you'll protect others as well from spreading COVID to them.
Okay, that's good to know, because the research, we've been talking about this for months now, the research is constantly evolving, and initially we heard, it's definitely going to protect you from severe illness, not quite sure if it's going to prevent you from spreading it, but now we're learning that it will likely prevent that spread as well.
That's right. We're getting more and more specific data, but we're also, you can look at, some of the countries that have gone ahead and had large vaccination campaigns, they've noticed big results. And that's often, that herd immunity effect is often that transmission effect. And we're starting to see some of that. Yes.
Okay, wonderful. And then Wings asks, Wings is our regular contributor. They ask, are there any conclusive studies about the first dose of Vaxzevria vector and the second dose as Pfizer, which is an mRNA vaccine, or vice versa? There is speculation that having both will increase efficacy against the variants of concern.
So we're waiting for more information on mixed dose schedules, more studies to come out. I'm not aware of any right now, but I do know that for example, in the UK, they're doing it. There are certain places where they are doing those studies. And so hopefully we'll get more information on that.
Okay. So we just talked about the spread after taking the vaccine. So Mayumi has a similar question. Do the vaccines prevent me from getting or spreading COVID-19? And are the existing vaccines effective for the new mutant viruses, and why?
Right. So yes, so it will prevent you. We have to realize though, like, let's set our expectations where they should be. The vaccine is going to prevent you from getting very sick and from being hospitalized and death. That's really the goal of vaccination. So that it does a very good job of doing. It will also prevent most people from getting sick, and then will also have some effect on that transmission piece, or being able to spread it to others. In terms of the variants that are out there, again, the variants are changing, and we're going to have to catch up to them to see how well the vaccines are working. The UK variant is what's in the UK. It's the predominant strain there, as well as in Israel. And we know that the vaccines, some of the vaccines that we use, like the AstraZeneca and the Pfizer, have been used there. And that population is getting protection. Now, again, the data, like in terms of the studies, are coming out to provide some more information on the variants. We don't have all of it. But that being said, it's not a reason not to be vaccinated, because even if there is a variant, often the vaccine can provide some protection, better protection than nothing.
Right, absolutely. And then let's see, Elizabeth asks, any idea how the US is doing with lowering COVID numbers, considering they have vaccinated so many people? And when can we expect to see the vaccines working and taking effect in lowering the numbers in Canada?
Yeah, so from what I've seen in terms of the numbers in the US, it looks like about 40% of their population has received vaccines. And their numbers are actually, looks like they're lower than ours now, which is, great for them. And so, what's that magical percentage that we need vaccinated to really start to see it? Well, I think the more people are vaccinated, the more we'll start to see the effects. We talk about that herd protection, might be somewhere between 60 to 80, 85% or something like that. Not quite clear. Again, some of it's going to depend on what's the dominant virus that's spreading. Is it the variant? Is it a variant? Or is it our typical COVID strain? That's also going to determine what levels of vaccination we need for that herd protection.
Right, that makes sense. And then let's see, Carl asks, my friend was told by his doctor not to get vaccinated because he had COVID 3 weeks ago. He said he would likely get very ill and he should wait. Is this true? And how long should how long should my friend wait to get vaccinated? He's 65.
So I would definitely recommend that you get vaccinated as soon as you're able to. So we say, while you're contagious, please don't leave your home and go to the vaccine clinic, because we don't want to spread COVID in those places. But once you're cleared from self-isolation, you can get vaccinated then. In terms of, will you get very sick after you get vaccinated because you have COVID? The evidence doesn't suggest that. You may have, again, the symptoms of fever, not feeling well, sore arm, maybe you might have those. A lot of people do have those, can experience those symptoms after a vaccine. The vaccine can sometimes act as a booster from your first infection, and can give you more of that long-lasting immunity, because we know that your actual infection, the immunity could wane within 3 months or so.
Right. And doctor, you had mentioned that there were studies going on regarding giving people who've had COVID already just the one shot of the vaccine as sort of a booster. Is there any more, conclusive evidence regarding that?
Yeah, so we don't have any recommendations for Canada just yet. Like France had made that recommendation. We don't have any here yet. So I think, again, yes, that's a good point to bring up, that more to come on that. Maybe if you had COVID, maybe you only need one dose. And so I think we'll be able to provide some more guidance in the future.
Okay. And then lots of questions about the 4-month gap, which is very much on everybody's mind. Deborah asks, when can I get my second AstraZeneca vaccine? They're not waiting 4 months in the US.
So with AstraZeneca, actually, the longer interval, so in the product monograph, it talks about 30 days to 12 weeks. And there are some studies that have shown that the longer interval, the 12 weeks, actually gives you the better immune response. And so there actually may be benefit in extending that interval, especially for the AstraZeneca vaccine. I think what's important to know is as we get more and more vaccine supply, we can shorten that interval. The interval, 4 months, is very much about saving as many lives as we can. We have more data on that, more modeling to suggest that we can actually prevent 10% more deaths if we give more people a single dose. But if we get enough vaccine, if we have enough supply, then we can shorten that dose as well.
And so Cami asks again about this 4-month gap. Are there any concerns that should supply chains of vaccines falter, that second dose may not be administered within 4 months? And if that were to happen, would the antibodies deteriorate to the point where we would have to start from scratch again and take the first dose again and then take a second dose?
So you won't have to repeat the series. There's not likely to be that recommendation. I think the supply seems to suggest that we're going to get that much more vaccine as time goes on. So hopeful that we won't have to extend more than 4 months. I mean, that would be an extreme situation right now based on the way the scenarios are looking. What we do know, though, is based on, again, I talked about that modeling data that was done from the Public Health Agency of Canada that actually showed even extending out to 6 months can provide good protection as well. And again, remember with your vaccine immunity, it doesn't just drop off. If it goes, it wanes slowly. And so it would take many, maybe even years, I don't even know, months before your immunity went down to zero. And so if this worst case scenario happened and you got your vaccine at 6 months, that 6 months again boosts you to get your immunity back up.
Okay. Joe has an interesting question. Again, this is about age groups and when people are going to get vaccinated. Both my parents are vaccinated. One is 80 plus and the other is 75 plus, and I live with them and we live in a hotspot, but they do go out and shop in the community and can possibly bring back COVID-19 to me. I cannot work from home. I'm working retail, and I am within the 40 to 49 age group. With my work, I can't really chase down pop-up clinics and mobile clinics. So what options do I have?
So right now your option is to wait, and as we do more groups, we will be able to open up more age groups down. And so what I would definitely recommend is keep doing your public health measures. So meaning wear your mask, keep your distance, stay at home as much as possible. I mean, those still do work. They really do work. To help prevent you from getting COVID, especially until you can get vaccinated.
Right. Anna asks, our vaccine task force changed their recommendation on AstraZeneca several times, and now it's recommended for people only above 55. With the risk of the clotting disorder and even death, this is the vaccine that people do not want to take right now. Is this the right time to pause that vaccine rollout until further investigation?
So this is under active discussion at Health Canada, looking at the product label and through the National Advisory Committee on Immunization, absolutely. I think we have to be able to not just look at the vaccine and this rare event related to the vaccine, but also look at COVID. And our rates of COVID in the province are the highest that they've ever been in the past year. And so we have to be able to recognize that we're right now in a crisis for COVID and have to take measures to be able to prevent as many cases as we can, to prevent people from dying of COVID. And so I think that's what we have to look at. It's not just about this one vaccine that has this one rare side effect.
Right. And again, more about age groups. So Anonymous asks, why is it up to the public health unit to decide on when to open certain age groups? I've read that in Toronto, it's now open for people of any age group to pre-register for vaccines. In the Guelph area, it's open to 18 plus. Anonymous is in the Kitchener-Waterloo area, and they're still at 55 plus, or for certain conditions. So why, firstly, the first part of the question is, why is it up to public health units, like specific public health units?
Right. So actually, a lot of it is based on the risk within who's the highest risk within the public health unit. And so you'll see in Toronto, it's 50 plus. you can book an appointment at a Toronto clinic. Some of it is based on vaccine supply, and the vaccine supplies are going to some of the higher risk areas to allow them to open up to different age groups. So that's part of the answer. The other part is based on, often it's the vaccine supply that is the biggest limiting step. The vaccine capacity, like, clinics to be able to book people in, seems to be very good, and places can actually manage that. It's really the supply, that how much vaccine is coming into each of the health units, that is the biggest determining step.
Okay. And then the follow-up question there is, in phase 2, certain conditions such as people with Down syndrome and autism are allowed to register, but other conditions like OCD and anxiety are not. What is the difference?
So there is a highest risk, high risk, and then at-risk conditions. And so after you go to the highest risk and high risk, it will be the at-risk. And in the at-risk conditions, mental health conditions are listed there. For people who have one of those and meet the criteria, they'll be able to book at that time. And that will be next after the highest and high risk.
Okay, and are we looking towards June for that, closer to the time when everybody is sort of going to get their first dose?
Right now on the schedule, it's slotted for the whole group between April to May, and so it will be before the general population.
Okay. And then Shannon has more of a comment, but still, let's ask this question. Shannon says all kids need to get vaccinated. So what are the plans for kids like younger than 18? Because right now we only have 18 plus.
Yeah. So right now, Pfizer is licensed for 16 and up. And we've heard from the US that they've asked for an extension of their licensure to 12 to 15, so it will cover from 12 years of age and up. So we do certainly, that's one step, is to make sure that the vaccine is licensed in kids. And then there is a plan, there is a working group, I'm a part of that, looking at what our recommendations are to vaccinate children, actually. And so that is in the works.
Okay. And then at Stokes ask, my son lives in one of the postal code hot zones and still can't get an appointment through May and June. Why is that the case? So right now, it's kind of week by week, like in terms of the eligibility and how much vaccine supply. We've heard that the Moderna supply has been delayed again. So again, all of these supply delays impact how soon people can book based on their eligibility. And though if you live in a hotspot and are identified in a hotspot, you are to be eligible before the general population. And so it's a hard thing to say, kind of keep track of the eligibility and keep track of the clinics. The clinic availability is mostly based on how much vaccine they have. And then Elena asks, local pharmacies are not scheduling second dose appointments for AstraZeneca, whereas the province is automatically scheduling the second appointments for Pfizer and Moderna. Why is this the case, given that the Ministry of Health has advised scheduling second doses at the time of the first dose?
Yeah, so pharmacy appointments that have been, or vaccinations that have been done, will be going into this provincial registry, COVAX, which I had talked about earlier. And so based on that system, you will get a second dose appointment. If you haven't heard yet, I would follow up with your pharmacy.
Right. This is interesting. Anonymous asks, is there something wrong with the AstraZeneca and Johnson Johnson vaccines? Why is it that they seem to be causing blood clots and the other vaccines do not? Is it something to do with how they are made or the mode of use, like mRNA versus adenovirus?
So I think this is actually the million-dollar question. This is what scientists are trying to figure out. What is it? First of all, is it the vaccine that's causing this? If it is the vaccine, what is it about the vaccine? Is it both vaccines, the AstraZeneca and the Johnson and Johnson? If so, both of them are these viral vector vaccines. They use the adenovirus and inactivated adenovirus vector. Is it part of that? So they're trying to pinpoint what is exactly going on, but haven't been able to do that yet. And so I think as we have more information, more analysis, more investigation, we should hopefully be able to come up with more.
Right. And here's another one, another anonymous one. A friend of mine is living in a long-term care facility while recovering from a stroke. As far as I know, all the residents have had both shots of their vaccine, yet they keep having to get tested and self-quarantine as staff or visitors to the facility have tested positive for COVID. So why would they still need to isolate if all of the residents have been given both shots?
So, again, the long-term care homes are, we have to be extra cautious in these places. We've seen throughout the pandemic that outbreaks can actually spread quite quickly. People can die quite easily. We have certainly seen a very dramatic improvement with the vaccines, but now we have variants. And so variants are, again, another reason to be a bit more cautious in these settings that, how well do the variants provide protection? Again, we're trying to answer that question. And so in the meanwhile, it's a more conservative approach.
Right, yes. And honestly, at this point, better safe than sorry, right? Like more conservative is better than trying to take those risks.
Yeah, exactly. And we've seen, again, some of these variant outbreaks, like I think we all remember Roberta Place in Barrie, and it can spread quite quickly. And so, when you're vaccinated, you're not expecting that, but even still, we don't know enough right now. And so again, it's that better safe than sorry approach right now.
Right, absolutely. And we have about 5 minutes left, so we're going to keep going with our vaccine questions here. Angela asks, what vaccine is being given at the Toronto pop-up clinics for 18 to 49-year-olds? Not much information is being provided about what vaccine will be given in those pop-ups.
Right. So I can't guarantee what vaccine will be provided, actually. So the vaccines that come in every week. I think what you can be sure is that AstraZeneca is being given to 55 years and older. So if you're younger than 55, it won't be AstraZeneca, and then it will be either Pfizer or Moderna.
Right. Okay. And then Meg asks, why aren't daycare staff being vaccinated along with other teachers? Schools are closed, but daycares are not. And we work physically closer with the children.
Right. So right now, daycare staff are eligible as essential workers, which is mid-May eligibility. In general, it will have to wait for provincial announcements to determine if childcare workers will be getting the vaccine before mid-May. Okay.
And then we have a little bit of time, so we're going to squeeze in a few non-vaccine related questions here. This one is from Twitter, so the person's handle is RGDRN. They ask, since the variants seem to be attacking younger adults worse, can we expect this to develop into a variant that will eventually affect children worse? And if so, where does that leave us with regards to vaccines for children, like we just talked about?
Yeah, so I think right now we're not necessarily seeing that children are more impacted by the variants. Certainly children can get the variants. We are still seeing that children tend to be less likely to end up in hospital, which is good. But yes, the long-term strategy is, unless we protect children through vaccinations, that they will be a large susceptible group. And so first we need vaccines that are licensed for children, then we need the vaccines, and then we need a strategy.
Right, absolutely. And this is a good one about variants. Angela asks, what is it that makes the variant viruses more contagious? Is it airborne longer? Does it last longer on surfaces? Why is it more contagious?
Yeah, good question, Angela. I'm trying to kind of pinpoint what is it. I'm not sure that it's the surfaces that are the reason why. It could be viral load, like because when someone is contagious, they have that much more virus on them, so that can spread. And that's why if you're not wearing your PPE or your mask or whatever properly, a little bit might be enough to make you sick. So there are a number of reasons why it could be the case. I don't think we've pinpointed exactly why these variants spread more. We just know that they do.
Okay. And then Dave asks, how do you tell one variant from the other?
So actually, it's based on laboratory testing, really looking at the genes. And so the test that we have in Ontario looks for a specific gene. That gene is present in variants and then goes on. You can actually do full genomic sequencing, if that means anything to you, to check to see which exactly the variant it is.
Okay, and then just 1 minute left. So let's get to this one. Are pregnant women more at risk to get COVID-19? Would you recommend any extra precautions for pregnant women above the government recommendations for the general public?
So pregnant women are not more at risk to get it. Like, I think your risk will be based on what you're exposed to, where you work, where you live, who you live with. But if a pregnant person gets COVID, they can get a more severe infection.
Right, and so vaccines are recommended now for pregnant women, correct?
That's right. So the Society of Obstetricians and Gynecologists of Canada and many other groups are recommending that if you're pregnant, that you consider getting vaccinated because it is recommended for you.
Okay, wonderful. And that brings us to 1 o'clock. Thank you so much, Doctor, for joining us again today. Thank you to everybody that submitted live questions. I apologize if we didn't get to them, but we will have the doctor with us again next week, so you can ask her the questions then. Thanks so much, Doctor.
Okay, bye-bye.
Bye-bye.